Stay connected. Make sure you hit the subscribe button. Tim Bennett here from the Cortland Voice, and I'm here with Dr. Gregory Ripich from Cayuga Medical. Doctor, how are you today?
I'm great, Tim. How are you doing? I really appreciate having me on today.
Well, thank you for coming. So, Doctor, tell us, about your practice and what you do and how long you've been a surgeon.
Sure. I've been a surgeon for at least 25 years. I practice right now in Ithaca at Cayuga Medical.
Mhm.
I practiced initially in Syracuse for a number of years, and I came down to Ithaca to help start a robotic surgery program at Cayuga Medical.
Okay.
I,
So I'm sorry. What were you saying?
what I was saying is that I both perform robotic surgery and also teach and proctor robotic surgery here in Ithaca and in different parts of the country.
Oh wow, I didn't know you taught as well. So I want to throw this in. So I know that you opened a practice in Ithaca, but then do you also have one? You do have an office in Cortland as well, right?
Yes, so right now my office is primarily in Cortland. I do my surgery and practice and my teaching in Ithaca, but
Okay.
I have an office on Commons Avenue in Cortland to help uh, be available for the Cortland community. Cortland community.
Okay. So tell me about all of these services that you offer. I know you do robotic and things like that. Like tell me, like let's dive into it. What would be a minimally invasive surgery? Like tell me about that.
So, minimally invasive surgery is an advancement from old traditional surgery with large incisions, long recoveries, higher infection rates. Minimally invasive surgery is done through very small incisions
Mm.
under general anesthesia with cameras and small instruments. Robotic surgery is a type or an advanced type of minimally invasive surgery where we use the Da Vinci robot. I'm sure you've heard that name before.
Mhm.
And that robot helps us to perform very precise, minimally invasive surgery. So it gives us three-dimensional vision rather than standard minimally invasive surgery, which is only two-dimensional vision. So we actually look into a machine and we have depth perception with these incredible cameras. And it is very precise instrumentation. Our instruments have greater movements than the human hand. So it's like having two small hands inside the human body up close. It's very incredible surgery. The technology is wonderful. We see faster recovery, less infection rates, less pain, get back to work quicker. It's really a great technology.
Now, let me ask you this. So besides having like, the smaller cuts and, it's like having an additional set of tiny hands, is there any other ways that robotic surgery might be different?
Well, it's not. When people talk about robotic surgery, some people think that there's a robot in the room acting on its own, and that's not what's happening. So I'm performing the surgery, or any of our robotic surgeons are. We have gynecologic surgeons at Ithaca and general surgeons all doing the surgery for different types of problems. Um, and what else were you asking? The how is it different? Did you say?
Yeah,
Uh, that's that. The majority is that the significant difference is that we have incredible vision and very precise movements. So much more accurate, much less blood loss, much more precise surgery.
I see. So what kind of surgeries or what kind of cases do you have the most?
So we can see all sorts of cases here in Portland. Anybody with problems with hernias,
Hmm.
both from old incisions, big hernias in their abdomen, or groin hernias that a lot of people see, umbilical hernias. Also, we take care of things like hiatal hernias, people who have problems with heartburn and reflux from hernias inside their chest. We also do gallbladder surgery, appendix surgery, some urgent surgeries like appendix surgery, and a lot of cancer surgery, colon cancer, stomach cancer, different problems like that that we see inside the abdomen.
So does your office is it basically that you partner with the oncology department or an oncology surgeon for that surgery, or you would just take care of that yourself? Like, how does it work?
We work together. So cancer is treated with both through both the oncologists who might administer chemotherapy, radiation oncologists who may supply radiation treatment, and surgeons who work with removing tumors and treating tumors surgically. So we all work together. So you might see me first and then see the oncologist later, or someone may be referred to one of the oncologists and then come to me later, depending on how the cancer is treated. Most people are with cancer are talked about at our tumor board, so it's a whole host of physicians who specialize in cancer treatment, and the best practice is considered and treated. So
Makes sense.
yeah.
So I know that June is Hernia Awareness Month. How do you even know if you have, if you have issues with a hernia or if it's something else? Like, what's the feeling like?
It's a great question. So many people don't know they have a hernia. Maybe they go to their primary care physician for a checkup and they say, "Oh, by the way, did you know you have a hernia?" Other people may find that they have some pain in their abdomen, in the groin, around the belly button, or anywhere in their abdomen, or even notice a bulge in their abdomen, a lump or a bulge. Those can move in and out of the abdomen or be stable there. And those are things that we're always happy to look at for you. The best way to find out if you have a hernia is to come in and see one of us. That's one of the things I do in the office. I see patients for evaluations to see if they have a hernia or problems with their gallbladder or other things. We also see patients with smaller problems in the office, so we're there for that as well. So if there's ever a question, the best thing to do is come in and see us. We're happy to see anybody anytime. There's no problem that's too small. But those are the major symptoms: pain, noticing a bulge, especially maybe with activity, work, exercise. Those
So
are
if
some.
you're
Yeah.
so if you're feeling off, call.
Certainly, if you're feeling off, or if you just notice one of the things. Some people have these hernias and they don't seem to bother them, and so they ignore them. The problem with hernias is they are an actual hole in the muscles. And with any exercise or exertion or straining, your intestines can actually push through that hole and get stuck, incarcerated, or trapped in there. And then they can also strangulate or get choked off. So they can be very dangerous. So it's always important to let a physician, especially a surgeon, identify that and talk to you about your risk. People can have a hernia for years and never have a problem. And suddenly, at the most inopportune time, 4th of July, their daughter's wedding, there's somebody's graduation, suddenly their hernia is a problem. And it's always Friday night at 11 o'clock when, it's never a good time. So the surgeries are usually day surgeries. People come in and go home the same day.
Oh, wow.
So elective surgeries are much more well tolerated than emergency surgery with any problems. So, like I say, it's very important to come in and let us see it and talk to you about the options and whether you need to do anything or not.
Okay. So if someone or when someone decides, hey, I'm not feeling well, I want to get this taken care of, how should they contact you in your office?
But yeah, great question. They should always, they could feel free to give our office a call. They can get in touch with us through the hospital or directly through our office, and we can supply the number. And we're right here, right in town in Cortland, right on Commons Ave. We're there all day, every day during normal business hours, Monday through Friday. People can come and see us. There's also an urgent care there if they thought they had a problem later at night that can connect us as well.
Awesome. And for those watching, we will also put that information at the end of the video so that you have a way to get in touch with the doctor. Doctor, was there anything else you would like to say to our greater Cortland community before we end the interview?
No, we're just very happy to be, other than we're very happy to be here in the Cortland community serving the people we look forward to helping and giving them the latest in technology and care, things that they shouldn't be afraid to have their hernias evaluated or even repaired, or any of their surgical issues, especially with this incredible technology, minimally invasive, minimal pain, fast recovery, and back to work. We welcome that, and we'd love to have people come and see us.
Well, thank you once again for coming on this today, and for everyone watching us, thank you for choosing the Cortland Voice. God bless.
Have a great day.
Stay connected. Make sure you hit the subscribe button